Morning.
Yeah. That one's easy. We all seen
I said it
evidence
first,
of that.
so I get the point.
What evidence do we see, Tira?
Well, we do call it morning wood for a reason, right?
Hi there, you're listening to the Kingdom Sexuality podcast. We're Alana, Kyle, and Tira, friends who have a heart for intimacy and long to uncover God's truth and design for sexual freedom within marriage. If you enjoy listening to our episodes or like our content over on Instagram, would you consider leaving a review or subscribing? It really helps. Welcome here.
Hey, welcome back to another episode of the Kingdom Sexuality podcast. I'm Tira, joined by my wonderful co-hosts, Alana and Kyle. And of course, a special welcome to all the patrons who are listening. If you want to support the show, get free stuff, see hump day positions to keep your sex life active, you want to go check us out there at patreon.com/Kingdom Sexuality. All right, the verse for today is 3 John 1 verse 2. Dear friend, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well. Okay, before we start, here's just a quick word from one of our amazing sponsors who helps make this show possible. Okay, so obviously you know what this episode is about. We're talking about testosterone today. I'm just going to put a disclaimer on here that everything that we talk about in this episode is for educational purposes only and not a substitute for medical advice. We're not doctors. We're just friends sharing what we've learned. And so, yeah, we want to say always talk to your healthcare provider before making any decisions about testing, supplements, or treatment related to hormones or testosterone. A big thing for this topic because there are a lot of ways that you could go about getting testosterone. Even researching for this episode was a bit tricky to sift out good from bad. Like even just listening, like, okay, let's listen to a few podcasts about it and going through which ones are going to be medically accurate or like which ones are wanting to sell you things, right? Because you think of for guys bulking up and needing testosterone for whatever and being the manly one and all that. So yeah, testosterone is definitely something to talk about your doctor with. Okay, and you guys know my fashion of doing episodes. I love to do quizzes. So we're gonna see how much you know about testosterone here. So the first one, true or false? Only men produce testosterone.
False.
Good. I'm glad you got that one.
Phew.
Yeah, no, women also produce testosterone too. So, and we're going to talk about that in this episode. Number 2, which of these is not a symptom of low testosterone in men? A, low sex drive. B, mood swings. C, hair growth on palms. Or D, low energy.
I wish you could see my face and Alana's face right now. Oh. Yeah, hair growth on the palms, I'm going to say.
Okay, so when I created this one, apparently there's like an old wives' myth thing. That if you have hairy palms, it means you have low or high testosterone or low testosterone.
Which one? Yeah. High or low?
Which of these is not a symptom of low? Oh, so low. That if you have hairy palms, you'd be low in testosterone. So not a thing.
So wait, which one is not a symptom?
Hair growth on palms.
Okay.
Yeah. Okay. In women, testosterone helps with all of the following except A, libido, B, bone strength, C, muscle tone, D, menstrual cycle regulation.
B.
D,
yes. So the menstrual cycle is driven by estrogen and progesterone. Testosterone supports libido, energy, and mood side of things, but it doesn't help regulate the cycle.
It helps with bone strength?
Yeah. It's interesting. We're going to get into it later, but
okay.
Yeah. Okay. 4, at what age does testosterone typically start declining in men? Age 18, 25, 30, or 45?
45.
30.
Yep. How about declining in women? 20, 30, 40, or after menopause?
After menopause.
40.
20.
Holy.
Yeah.
What?
Yep. So yeah, 20s for women, 30s for men. Okay. What time of the day is testosterone naturally highest? Oh, I guess I need to give the options. Morning, afternoon, evening, or midnight?
Morning.
Yeah. That one's easy. We all seen evidence
I said it first,
of that.
so I get the point.
What evidence do we see, Tira?
Well, we do call it morning wood for a reason, right?
Mm.
Okay, which of these is not commonly associated with low testosterone in men? A, trouble sleeping. B, increased body fat. C, constantly feeling cold. D, decreased motivation.
Feeling cold.
Mm-hmm.
I'm going to go
Cold.
with C.
Correct. So if you are feeling that, you should probably get your thyroid checked. Thermal regulation is what the thyroid is in charge of. Number 8, which of these habits can interfere with healthy testosterone levels the most? A, drinking black coffee. B, doing long distance cardio daily. C, eating leafy greens. D, taking rest days from workouts.
Which of these is not good for you? Coffee.
I'm going to go with long distance cardio.
Ding, ding. Yeah.
What?
Long distance cardio daily. Yeah.
Haha.
I guess that conflicts with D, so yeah, I should have seen that.
Okay, we're going into a little bit harder, more scientific here. Which hormone helps convert testosterone into estrogen in the body? A, progesterone. B, cortisol. C, aromatase. D, leptin.
C.
D.
C for the win. So this enzyme converts testosterone into estrogen, especially in fat tissue. That's why excess body fat can throw hormone levels off and can make your estrogen levels go up. Which part of the body signals the testicles or ovaries to make testosterone? A, the pituitary gland. B, thyroid. C, hypothalamus. Or D, adrenal glands.
A.
C.
A, the pituitary. Yeah. So
Remember something from my hormone class way back in the day.
Yeah.
Or no, not my hormone class. What's that called? Endocrine system.
Yeah. Yeah. So the pituitary releases luteinizing hormone, the LH, which tells the body to produce testosterone. Okay. Which of these supplements has the most scientific support for boosting testosterone naturally in people who are deficient? A, ginseng. B, maca root. C, vitamin D. Or D, ashwagandha.
Oh, we did an episode and we talked about this.
B.
I'm going to go with B. Or D. I want to go with D.
It is actually C, vitamin D.
Oh, of course.
Yeah. So some herbs are promising.
Which
like
kind of vitamin D?
Like the other ones they are said to have improved it, but vitamin D is the one that has strong research backing, especially with those with low testosterone. Yeah. What time of day is best to test testosterone levels for accurate levels? A, just before bed. B, mid-afternoon. C, around 8 a.m. Or D, anytime. It doesn't matter.
C.
D.
So C, around 8 a.m. because testosterone is at the highest in the morning. So early testing gives the most accurate baseline.
I only know that because I did it when we had to do the Let's Get Checked one.
Right. Does having regular sex increase or decrease testosterone levels in men? Increase. Okay, so I still made this multiple choice. Increase, decrease, no change, only increases if it's once a week.
I can't tell if this is a trick question or not. I'm going to say increase.
I'm going to say no change.
Okay. Increase. So sexual activity and even arousal can cause a natural boost in testosterone level. Men who have regular intimacy often have higher baseline testosterone compared to those who don't. So
that's fun.
I love it. It's part of God's plan. The more you connect, the healthier your hormones will be. And the more you'll want to connect more. So let's just go over kind of what testosterone is used for in the body for both male and female. We know that, obviously we think of it more as the male hormone, but like we mentioned earlier, it is for both men and women. We have different things that it helps. It's interesting when at certain points in our cycle for women, we actually have higher level of testosterone than all of our other sex hormones. Isn't that crazy?
Yeah.
But men definitely have way higher levels than women of testosterone naturally in the body. For men, it's produced in the testicles. And the thing that it does for the body is it fuels sex drive, supports erectile function, helps with sperm production and the health of the sperm. It's a key for building and maintaining muscle mass. keeping bones strong, boosting energy, and stabilizing mood and motivation. For women, testosterone is made in the ovaries and adrenal glands, and even though the levels are lower than men, it's still important for us. It helps support libido, energy, mood, and mental clarity. It affects muscle tone, bone density, which again we'll talk about the difference. The bone health is different for men and women with this one, but and it helps with motivation and confidence. So yeah, it's an important
Great
thing.
question. So when I had an ovarian cyst and they removed one of my ovaries.
Yeah.
So do I have less testosterone as a woman if I have one less ovary?
No, not usually. If you have one ovary still there, your body just transitions to making the amounts that you did before. So you're not low in anything if you still have at least one healthy working one. Yeah. Okay, so we're going to start off with the signs of low testosterone in men, because generally, probably if you clicked on this episode, there's probably some question maybe whether you as a man or wife you're listening, checking about it for men or for your husband. So a big one is low sex drive or low libido. So this is probably one of the most noticeable signs, because testosterone fuels the sexual desire. And so therefore low levels mean a decrease in the interest in sex. Erectile dysfunction, so it can contribute difficulty getting or maintaining an erection, especially fewer or weaker morning erections. So that might be something to keep an eye on. Yeah, if you're starting to notice that, especially as you age, right? So levels in both men and women continue to decline as we get older. Fatigue or low energy. So men with low testosterone often feel constantly tired, even when they're getting full night's sleep. They may lack the energy or motivation to get things done. Mood changes or irritability. So testosterone influences mood, and low levels can lead to irritability, anxiety, mood swings, or feeling emotionally flat or disconnected. Decreased muscle mass and strength. So testosterone helps build and maintain muscle. That's why testosterone is such a big thing in the bodybuilding area. If you're low in testosterone, you as a guy might notice that you're getting weaker or even losing muscle tone even when you're exercising. Increase body fat. So drop in testosterone can change your body composition, and it shows up usually as that inner tube around the middle. So that's a common side effect. Reduced bone density. So testosterone supports bone health. When it's low, men are at greater risk for thinning bones, and so therefore getting fractures and stuff over time. So the difference between men and women in this area is bone density. For men, the testosterone is going to help support and continue to help build basically the bones. So if you are low in testosterone, this is actually a big deal. Like if nothing else mattered, like you didn't really care about your sex drive, even maybe you're not married, you're not having sex, that's not a big deal. Not having enough testosterone can affect your bones, especially if you're younger with low T. You can develop osteoporosis as you get older because you're not having those bones. For women, testosterone does help the bones a bit, but our protection for our bone density comes from estrogen. And that's the main thing. So like when you go through perimenopause and postmenopause, your estrogen levels drop significantly, and we actually lose a ton of bone density. Within about 5 to 7 years, we lose a huge chunk of our bone density, all because of that estrogen missing. So anyway, so this is one big difference between male and female in how testosterone is used in our body. So going back to the guys, you might notice hair loss on body, face, or your head. While hair loss is often genetic, low testosterone can lead to loss of body or facial hair as well. Memory and focus issues, so like brain fog. Men may experience trouble concentrating, forgetfulness, or a general lack of mental clarity. Decreased motivation or drive. This one's a big one. It can affect ambition or motivation in all areas of life, not just the bedroom. You may notice you'll have smaller testicles because testosterone affects testicle size, and low levels over time can cause shrinkage. Low semen volume. Testosterone plays a role in semen production, so ejaculation volume may be noticeably lower. Low sperm count and quality. This can reduce the number of sperm produced, especially if it's linked to issues with the hypothalamus or pituitary gland, which signal the testicles to make testosterone and sperm. Low testosterone can negatively affect sperm motility, so that's how well they swim. Morphology, that's the shape and structure, and overall viability, so their ability to fertilize an egg. So if you if you're going through fertility issues, this is when you learn all of these things, because that's when you get your sperm tested, they test for each one of these things.
Yeah, because I was going to say, how would anyone know?
Yeah, you wouldn't. Yeah,
I think I have low sperm now.
It's all done through a microscope at a lab.
Mm-hmm.
They're able to say what percentage are good, and yeah, they usually say all the percentages of the good of what's there. So yeah, so even if there are sperm present, they may not be functioning optimally for conception. So sleep disturbances, so insomnia or light sleep, low testosterone can interfere with sleep quality and contribute to trouble falling asleep or staying asleep. And hot flashes or night sweats, though more commonly in women, men with very low testosterone can experience sudden episodes of heat or sweating. That was interesting. Didn't know that one. As I was going through like a lot of these, I noticed, like depression and low testosterone really have a lot of the same symptoms. So like it can be hard to tell, is it depression or is it low testosterone or maybe both? Right. And how can you tell the difference between the two? The symptoms are really similar. Like I said, low energy, mood swings, no motivation, low sex drive, poor sleep, brain fog, all of that stuff. But if it's low testosterone, no amount of counseling or prayer will fix the hormone imbalance, unless it's God chooses to do a miracle. But if it's depression, testosterone treatment alone won't solve the deeper, emotional or mental health stuff that's going on. So it doesn't really help you in the okay, which one is it? You actually have to try treatment first in order to see which one it is.
Right. Or getting tested to see if you have.
Yeah. That's what I mean. I still have to take another step. It's not just right. Oh yeah, I think it's this one. Yeah.
Right.
Yeah. And it sucks because low testosterone can cause depression, and depression can contribute to low testosterone. So they kind of work off of each other in some instances as well. So what should you do if you suspect that you're low testosterone? Like Alana said, get checked. You can go to your doctor or you can go online. Do we have
Yeah, you can go to Everlywell is an online testing center where they'll send you a kit. You take some blood, put it in the thing, send it back, and then they'll send you guys your results. You can, we'll link it in the show notes if anyone is interested in that.
Yeah. So you don't even have an excuse of I don't want to go book a doctor's appointment. Nope. You can just do it in your own home.
So you draw your own blood at home?
Yeah, when I did it, it was a finger prick. And so you prick your finger and then you squeeze blood into this little vial.
It tells you how many drops probably, right?
There's a line on the vial you have to get to.
Oh, yeah.
And it's a decent amount. I had to prick 2 fingers to get enough blood out of there to get there. So I don't even think I got to there. I was like, that should be close enough. And it was. But you prick your finger and then you just milk yourself of blood.
Yeah, I remember doing that for because you can get find out the gender of your baby way earlier. I think at 6 weeks you can do it, and it's with a blood test. And same thing. Prick at home, and it took way long. I was like, this should be fine, and then it was 1 drop, and then it started to coagulate already. And I'm like, no, I need more. And I actually bruised my whole finger from trying to push it out too much. So then I had to go to another finger, and you have to keep the whole area super sterile. And they give you a little finger poke thingy. So it's easy.
Yeah, you're not taking your steak knife and poking yourself in the tip of the finger.
Yeah, walks you through it. And
it's like a diabetes finger pricker.
Yeah. Except you need more than 1 drop of blood.
Yep.
Anyway, so you can do that and get some laughs out of it, get some stories, because it definitely is an experience to do it at home. And then you can always go talk to a counselor too if you think that something else is going on. We love my counselor online, so we'll link them in the show notes too. You get $25 off your first month when you sign up with our link, so you can go check that out. Okay. So what does treatment look like? So let's say you get diagnosed, what steps are next? So I did say the most common one right now is testosterone replacement therapy. It's the most direct way to raise testosterone levels. You're literally replacing what the body isn't making enough in. So there's different forms of it. You can get gels. So it's rubbed on the skin, usually the shoulders or the arms, and it absorbs through the skin. So it's nice because it's super easy, but the cons, and this is a pretty big one, especially if you have a family, you have to be careful around others because it can be very dangerous for us women to be exposed to it and kids. So it's a bit tricky because it can still be on your skin. Like say you're going in the pool or something, you'll still kind of feel the gel on. And so it transfers through skin contact. So you're just going to have to be more cognizant of what your activities are and stuff to use that one. Injections. So given every 1 to 2 weeks, sometimes weekly at home or in a clinic. The pros is cost effective and it's very effective at raising levels. Cons are that you may feel a hormone roller coaster because it's going to be really high after the injection and then you'll sink kind of low before the next one, unless it's managed well. So I assume you'll get used to what your body needs, but it might be a bit of a roller coaster at the beginning. Pellets. So these are implanted under the skin every few months by a doctor. The pros is that it's super low maintenance and you don't have to think about it. You're not going to expose testosterone to anybody in your family. The cons is it's minor surgery and you can't really adjust the dose once it's inserted. Like it's there in you. And then there's patches, which are worn daily, kind of like a nicotine patch. The pros are that it's like a steady absorption. Cons is that it can cause skin irritation or may fall off with sweat. The big downside to testosterone replacement therapy is that it can reduce fertility because it signals your body to stop producing its own testosterone and sperm. So if you're hoping to have kids, it might not be your first option. You'll have to talk with either your doctor or an endocrinologist all about this. They'll be able to tell you like how long it's okay to be on it or not, or like what your risks are. The second one is Clomid. And if any of you have gone through infertility treatment, you will probably recognize this name. It's a drug that we as women are given to help us produce more eggs every cycle so that your chances of getting pregnant are higher. So, so this was interesting. So this is an off-label medication used for men who want to raise their testosterone without hurting their fertility. So it works by stimulating your brain to send more signals to your testes to make testosterone. So the pros are it doesn't suppress sperm production and obviously good for those who are trying to conceive. The cons is that it's not FDA approved specifically for this purpose, right? It's off-label. So it was interesting because I thought, well, are there any other cons? Like, are there any side effects? And there wasn't really. So I don't know. To me, I'm like, well, that sounds a lot easier than all the other ones.
Is it oral? Like, are you taking?
Yeah, it's just a pill. Yeah.
Because testosterone, like, notoriously is unable to be taken orally.
Yeah.
The liver just eats it up so fast. It doesn't get into the blood.
Mm-hmm. Mm-hmm.
Interesting.
Oh, interesting.
Yeah. Then HCG. So that's a human.
Chorionic gonadotropin.
Got the
HCG,
gonadotropin.
that's when you're pregnant. There's HCG.
Yeah. So it's the same one used in pregnancy tests. In men, it mimics LH. So that was that hormone that stimulates the testes. So it encourages them to make more testosterone naturally, sometimes used alone or alongside TRT, that testosterone replacement therapy, to protect fertility and testicle size. So the pros is that it preserves fertility and testicular function. And the cons is that it requires injections and often needs to be paired with other medications.
I have a question.
Yeah.
Protect testicle size.
I don't know if we need to.
Do testicles get large if you're taking testosterone?
Oh, I don't know.
Because if they shrink when you are low testosterone, do they increase?
Well, I think maybe protect means protect them from getting smaller by using the testosterone.
Okay.
Like having more testosterone.
Yeah. Okay, and then the natural or like lifestyle change approaches. So these won't replace testosterone if your levels are really low. But if you have just mildly low, then this is something maybe to look into and try hard for, because then you don't have to go on anything.
Well, and none of these are bad things to do.
Yeah.
Anyways.
Yeah. No, these are all really good. So one of the biggest things is weight training and resistance exercises, like the big heavy weights. All of that really helps boost testosterone. Quality sleep. So I know we just did an episode on sleep a few weeks ago. So you should go take a look at that because it definitely lets us know, just how important sleep is.
As Kyle yawns.
Reducing stress, which I feel like is a treatment for everything.
Yeah. Just don't be stressed.
Yeah. So stress, chronic
Just
stress
relax.
raises cortisol, which suppresses all your other good hormones, and losing excess belly fat. So those fat cells, especially around the midsection, convert testosterone to estrogen, which is kind of sucky because it's kind of like the larger you are, the more estrogen you're going to produce, the less testosterone you're going to produce. It's kind of easier said than done, but
it's like, just relax. Just lose belly fat.
Once you start exercising and stuff and changing your eating, maybe that will help a bit. Vitamin D and zinc. So both support natural testosterone production. This is usually like when I'm helping my fertility clients, these are definitely two things. I also add selenium as well for sperm health, but those are definitely ones to take if you're trying to conceive and you have low. And then eating a balanced diet with healthy fats. Low fat diets can lower testosterone. So you definitely need healthy fats. And have more sex, because more sex helps higher your testosterone. Okay, so that is the coverage for the men. And now for women, I'm going to kind of take this in a different direction a bit. Symptoms of low T in women pretty much look the same. They have the same side effects kind of as the men, but unfortunately it's also symptoms of fluctuating or declining estrogen during perimenopause and postmenopause. So there's a lot of question as to what's going on. Like things
you
like
women
fatigue.
are always so difficult.
I know.
Jeez.
Seriously.
Fatigue, brain fog, mood swings, body changes, poor sleep, all of those could be either low estrogen or low testosterone, and it all depends on where you are in your lifeline. if you're in perimenopause or even coming up to perimenopause, that can start affecting it. So one important thing to know for low testosterone, the only thing that doctors are going to treat you for low testosterone is persistent low libido. That's basically the only medical reason to give you hormone therapy for testosterone, which is a whole other can of beans to talk about. In the future, I'll be doing an episode on menopause and sex. And within there, we're going to cover a lot more of that. So I'm not going to cover that today. So I'm sorry if you are in perimenopause and you were hoping to hear all about testosterone and how it helps libido and does all this stuff. I'm not actually going to talk about that too much today. If you are struggling with sexual desire and you are in that perimenopause stage, you can definitely talk to your doctor about it, because that is a therapy that can be prescribed to you. Yeah, just know that it might be estrogen, it might be testosterone, it could be both. You don't know. So definitely talk to your healthcare provider. And if you don't feel listened to from that healthcare provider, find somebody who is and is trained. You can look North American Menopause Society, NAMS, and they have a whole registry of doctors who have had extra, like they have to complete this exam that shows that they are knowledgeable in menopause things like in these last few years. So you can go find a NAMS certified practitioner near you. And it's not even just medical doctors, like naturopaths are on there and pharmacists are on there. So you might find a good resource if you feel like you're not being listened to. You can try a different doctor.
That Everlywell or whatever it was called.
They probably do. I would be hesitant you can test for low testosterone, but it still may show you in normal levels. But if you're perimenopausal and you're having low libido, they may still consider treating you with testosterone, even though your numbers are normal. And when you're in perimenopause, it's not really applicable to test for estrogen because we go through such crazy ups and downs. So you could get tested one day and it shows it's totally normal, get tested the next day and it's extremely low, get tested the next day and it's extremely high. So anything that is telling you to go get labs when you're in perimenopause for checking your hormones, it pretty much doesn't mean anything. All treatment is based on your symptoms, more or less. So
what a ripoff.
I know. Yeah. Testosterone can be tested. Like that one doesn't go up and down. That one is, but again, you can have you can have symptoms of low T and still have regular testosterone and get hormone replacement.
And still need T.
But you should be followed because you're going to want those levels rechecked and everything. You're going to want a professional making sure you're not taking too much, because there's a whole other downside of taking testosterone, having too much. For women, it can lower your voice and it can actually permanently lower your voice. So even if you've just done it for a section of time, it's like if you rely on your voice for your work or, that's something to know. You can get hair on your face. You can it's all the things that you kind of think of if you take testosterone.
Right.
So you're going to want to be followed by somebody so that they can give you the proper dosages and walk you through the pros and cons of what it would look like for you. Okay. So now I'm taking a shift because now I did want to talk about testosterone in women, but our more common one is actually to be high testosterone in women. And I know for a bunch of you are going to go like, what? I've never heard of that. And we're right away going to say, well, does that mean like if I have a super high sex drive, does that mean I'm high testosterone? No, it doesn't. Unfortunately, it doesn't work like that. Us women have to have all of our hormones kind of in balance and doing the right thing in order for our libido to match.
Remember, complicated.
Yes.
So complicated. I'm even
just
confused. And I'm a woman.
So yeah, unfortunately, having high testosterone is actually a very, it's becoming a lot more common.
Why?
And they don't know. I mean, you could chalk it up to like, it's all in our epigenetics of what's been passed down, what's going on the planet right now, all this stuff. It's affecting our hormones. So the biggest condition, like having high testosterone or high androgen count. So androgen are all the male type hormones, and that includes testosterone, is polycystic ovarian syndrome, PCOS. So I don't know. We haven't really talked about this on the podcast, but it's trying to think of how much it basically means your body is producing, it is starting to develop an egg to release. You know, like when we're in our cycle, we have an ovaries that produce eggs that are about to release, and only one becomes a dominant follicle that releases and becomes the egg for that cycle. In polycystic ovarian syndrome, PCOS, our body starts that process and we get a whole bunch of eggs that are about to, but no dominant follicle happens because of hormone communication. And so your ovary will look like it has a whole bunch of cysts. So that's why it's called many cystic. So on the ovaries. It's interesting though, because it gets more complicated. You can actually have PCOS without actually having seen all of those little cyst-like things on an ultrasound. So it actually is more diagnosed through blood work, seeing that you have a high androgen count, which includes the high testosterone. So what does high testosterone look like in women? Irregular or absent periods, because that dominant follicle didn't release and therefore didn't start the cycle. So for women who are trying to get pregnant, this can be a huge issue because it looks like you're about to ovulate. You may even get all the good stuff, the cervical mucus and everything, but you don't end up actually ovulating. And so you can't tell when's a good time to have sex in order to conceive. So it
Even
definitely,
if you're using something like a temp drop?
No, so temp drop won't work. The only one that would work is something like Mira fertility, because you're measuring, like it measures your urine and it gives you the accurate levels of what is happening right on that particular day. So it would keep track of, like you would see your LH going up, but then you would also see your other hormones. You would see progesterone going up after ovulation. So it also helps confirm that yes, you did ovulate, which temp drop kind of does, but it won't give you the heads up on when that's happening. Yeah, I could go on and on and on about, but we're talking about testosterone, so I'll try to stick to it. So people with high testosterone or PCOS often have extra facial hair or body hair, acne or oily skin, especially along the jawline or back. You can have that hair thinning on the scalp, weight gain, especially around the belly. This is probably the most frustrating, like apart from being difficult to get pregnant, weight gain is one of the biggest things because it produces insulin resistance, and it basically, I'll just say it gives you insulin resistance basically, which makes your body want to eat more sugar, and it just converts things into fat. And it's just this vicious cycle of it's extremely hard to lose weight and extremely hard to just like, oh, well, just change your diet and do this. Well, no, there's so many more functions happening within the hormone stuff that it isn't just like, oh yeah, just go on a diet and it will work. It's not. It's extremely difficult. And so that in itself can help you feel even lower libido, right? Because you're frustrated with how your body looks, weight or hair or acne, like all of that stuff is, and then when your body isn't working and you're trying to get pregnant, like it is just one huge
big blow to confidence.
Yeah. So it can affect your mood changes like irritability or low confidence. Yeah. And then we talked about Mira fertility. We can put a link in the show notes for that. You get $40 off your order when you click on that link. And I've used the Mira fertility and I think it's awesome. Like it's super fun, especially if you're really geeky like me and you like, it's fun to see exactly what your body is doing every day and how it changes. And it is actually a really, really helpful tool if you have PCOS and you're trying to get pregnant, because it can definitely help. And they have such good resources. If you go to their website, they have different pamphlets and everything, like PDF printouts, and PCOS is one of them. I like them so much that I actually save them in my, like when I'm working with fertility clients, I'll actually give them those PDFs because they're, just really good.
Is PCOS something that you can overcome? Or like, is it a forever thing?
So it's not curable, but you can get it to a state of management. It's definitely, you can do things to improve your condition so that it's not as bad. Women have been able to lead normal lives with it, but it does take a lot of work to do it. If you are struggling with it and are wanting to get help, that's what I do on the side from the podcast. So you can go to my page at belovedfertility.ca and you can see there and I can help you with that. Cause I'm just like touching the very tip of the iceberg when it comes to PCOS. And it's a huge deal and it's affecting so many women. It's definitely becoming a bigger deal. So, and I just want to like reiterate that if you are a woman who's struggling with this, you're not broken. It's a hormone imbalance and there are ways to support it. God designed our bodies with rhythms. And when these rhythms get disrupted, it's not your fault. It's just an invitation to get curious and seek support. It will take a bit of work and education, really. Like I said, treatment. There are different medications that kind of help with some things and supplements, all of that stuff there. It's not hopeless. It's not like you're stuck with this and these symptoms forever. So the treatment, lifestyle approaches, like you mentioned, weight management and exercise, losing a small amount of weight, even 5 to 10% can reduce your androgen levels. Strength training and consistent movement help improve insulin sensitivity. And there's a whole whack of things that you can do for insulin resistance that helps. That's usually the first go of how to help PCOS is getting rid of that insulin resistance. Dietary changes, lowering refined carbs and sugar, that can help stabilize the insulin, which then in turn lowers androgen production. And of course, stress reduction and sleep. We all love hearing that one. So medications, if you're not trying to get pregnant, actually the pill is helpful. It helps lower testosterone by increasing SHBG, which is the sex hormone binding globulin, which binds free testosterone and makes it less effective. Essentially, it will help. Spironolactone is an anti-androgen medication that blocks testosterone's effect on hair follicles and skin. So this is often used if you have really bad acne or excess hair growth. Metformin. This is a diabetes medication that improves your insulin resistance. So often if you're not able to get your insulin resistance under control, this is a medication that your doctor would prescribe for you to help with that. And other fertility medications, Clomid or letrozole can be used to induce ovulation when your high testosterone is causing irregular cycles. So this one's actually really good too if you're trying to get pregnant, because you basically go to the doctor, they'll give you the medication and it will help your body to basically release that dominant follicle so that you'll ovulate so that you can try to get pregnant. So it's a good one. Natural things that you can take. Inositol is the main one. Myo-inositol and D-chiro-inositol, but there's a certain ratio and stuff that you have to follow. So do your research, because if you take too much of the D-chiro, it can make things a lot worse. This one is definitely the main one if you have insulin resistance. Vitamin D and magnesium both support hormone balance and insulin function. So unfortunately, with high testosterone or PCOS, because of that higher weight and insulin resistance, you're going to be at higher risks of diabetes and heart disease and metabolic health issues. So I know that it sucks where you're at. And I don't want to like harp on and say, well, you should, you're going to need to do this, but just know that there is hope for it. There are things that you can do to help improve your situation. Yeah. And no, you're not alone. There are definitely so many women in this. Yeah. Okay. So we've covered a lot today. The takeaway is that hormones do matter. And if you're noticing changes in your mood, energy, or desire, you're not crazy. Just your body might be trying to tell you something. So get curious about it. Don't ignore it and don't feel ashamed of it. You're going to want to ask questions and do some research. See what's in your area for support. And yeah, there's going to be help somewhere around you for sure for any of these areas. So definitely take a look. Okay.
Hormones
any questions?
Crazy hormones.
Yeah. Any questions? We close in prayer now.
Close her up.
All right.
Close in prayer.
Lord Jesus, we thank you for making our bodies so unique and so, special in what they do and all of the different functions that affect other functions. And I just pray for any husband or wife today listening that can identify with either of those two, high or low testosterone levels, or that you would point them in the direction they need to go for support, whether that be doctor or support groups or natural doctor or just books or more resources. Lord, I just pray that you would highlight where they should go and help them to feel your hope in this area, and that it's a nudge to get their health under management. And we just thank you again for the success that will come out of those that seek help. Thank you for the day. Amen.
Amen. Hey friends, thank you so much for listening to today's episode. If you like our content, please like, review, and subscribe wherever you listen to your podcasts, and tell your friends too. Thanks so much for journeying with us today as we tackled the hard questions and dive deep into godly intimacy. Make sure you follow us on Instagram to see more of our content, and check the show notes for any links we might have mentioned in today's episode. We're so grateful to be on this journey with you, and we can't wait to see you in the next episode.